and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists of the day. On the internet. I was thinking, this is our first video of the day. I'm all pumped up, Brad,
Yeah,
ready to go here.
And I got to say, in our opinion, of
in
course,
your opinion,
Bob.
right. All right, let's go. What are we talking about?
Today we're talking about why physical therapy first, and we're talking about in the whole medical community. Why should someone go to physical therapy first before going to the doctor? And what are the benefits? How can physical therapy benefit patients and basically society? And
We're here to sell ourselves, basically.
well, basically, you're right. You know, physical therapists have come a long ways in the last 2 or 3 decades. And the other thing is I had a request from one of our viewers from Azerbaijan. There we go.
I hope you said right.
Right. It's right by the Caspian Sea, and the Physical Therapy Association there is interested in us doing a video.
Promoting physical therapy.
Right. So this is a global effort.
All right.
So why should we do physical therapy first?
I think we have 3 good reasons.
Right. The first one, simple, a great success rate.
Right. You know, I actually was told by one of the mentors that we follow, Mulligan, that if you follow his stuff, you'll see a miracle a day in the clinic. And I tell you, I bet you I don't see a miracle a day, but I see a miracle a week.
Right. Yeah.
Where somebody comes in and they've had a really bad time of it and they got better.
Right.
Well, so going through
and if you hold on, at the end of this video, we're going to give 3 separate examples of case histories that we worked with.
Very interesting studies.
And maybe they're not miracles, but they were certainly success cases.
Yes, exactly. and sometimes where they really had nowhere else and they were heading towards surgery.
Exactly.
Exactly. So back pain,
right,
neck pain, shoulder, knees, ankles. Any pains really that you're having.
Exactly. Itises, lateral epicondylitis, tennis elbow, golfer's elbow.
Sure. Patellar tendonitis.
Right. And there's a thing about what can physical therapy treat into the arms, into the hands. And of course we can. We're trained in the whole body from head to toe, from fingertips to toes. And
then there's the neurological issues going on. Let's say you have a stroke or Parkinson's disease or some other neurological condition. We're going to be able to, take care of all those.
Exactly.
And improve them.
And the thing is that the next big reason why physical therapy is cost.
Yes.
I don't know about around the world, but I'm sure it's the same as in the United States. Healthcare costs are really going
skyrocketing.
Up. Right. Last I heard was 7% per year, and that was a few years ago. It may be more than that by now.
In the United States, I guess more.
One way or another, it's going up, and it's going up quickly, and people cannot afford it, and it's getting to the point where the countries are, social medicine may not be able to afford it as well. I'm not sure about that as far as in those countries.
So with physical therapy, one of the things we're definitely trying to do is reduce the amount of surgeries.
Right.
Because I think quite often people end up having a surgery, and sometimes they don't even end up getting better. Or one surgery can lead to another.
Right.
I mean, we just had a discussion about this on another video.
Exactly.
So anytime you can stop having a surgery, the better it is. The body has an amazing capability of healing itself if you allow it. Mm-hmm. And that's what we are trying to do, is show you the things to allow the body to heal.
Exactly. If you go to a surgeon, they're going to think about surgery. If you go to a therapist, we're going to think about healing the more natural way through exercises, changes in habits, etc. Which leads to the next point is pain medication.
Right.
Pain medication, in my opinion, Bob's opinion too, is overused in the United States.
The less the better.
Right.
Quite often it's just masking the problem. It's not solving the problem.
Exactly.
It's just putting it on hold, basically. And if you continue to do what you're doing, it's just going to come right back again, even if you're on the med or once you get off the medication.
Exactly. Give an example, Bob. At the workplace, computers, so many people work on the computer workstation. Let's say their situation is the screen is low, they're like this, head forward posture, they're developing a disc problem in their neck. Pain here, pain down the arm, they go to the doctor.
Give you pain medication.
Pain medication. Well, you got to have some pain medication for that. You start taking that. That can lead into addiction if it's an opioid.
Dependent, yeah.
Right. And then, or if it doesn't get rid of the pain, or it does get rid of the pain, it masks the pain.
Right.
The person goes back, continues the same posture that started the problem, and exacerbates it to the point where the pain med no longer covers it, and then it leads to that surgery.
Right. And all you had to do is improve your posture.
Right.
You know, so there's these simple solutions if you just know where to look.
Right.
And if you have us helping you.
And a physical therapist is actually the person to ask or to be educated on ergonomics.
We're the experts.
Because we are biomechanics, and that's what ergonomics is all about.
And the big thing we emphasize, Brad, is self-treatment.
Right.
We're not trying to make you dependent, come in and keep seeing us.
Right. Give you a massage and hot pack and ultrasound. It feels really good. Come on back 3 times a week for the next 4 weeks. And
you know what those people are called, by the way?
What?
Hummers. Hot pack, ultrasound, and massage.
Yeah.
And we're not that, Brad and I. We want you to get better on your own if we can. And first time I see a lot of patients, I go, I'm going to give you this stuff to work on for 1 week, and I'll see you in a week. Come back.
Right.
So.
And you know what the first thing I do when a patient comes back? I say, can you show me the exercises?
Sure.
That tells me 2 things, if they're doing them properly or if they're doing them at all.
At all.
Right.
Because if they don't remember.
You know, they haven't been doing them. And if you don't do your homework, you're not going to improve. And it's like anything. You put some effort into it, it's going to come back and help you out. So.
And it tells you, people that really listen to us, they get better. Let's go with the 3 case histories, Brad.
Say no more.
Okay, let's start with an ankle sprain. I had a lady that came in, and she had sprained her ankle a whole month ago, prior.
Sure.
I mean, so it should have been starting to get better, but
Right.
it wasn't. And the reason it wasn't getting better, because sometimes with an ankle sprain, you sprain the little ligament right here, this bone right here gets shoved a little bit out of place.
Yep, gets moved forward
Yeah, it
typically.
gets moved forward. And so we do this simple mobilization where we actually just push on it, and we push it, and then we tape it back.
Right.
And it was almost, that was my miracle of the week, Brad, because she went from walking with crutches still a month out from the sprain.
Sure.
2 days later, she was walking fine without any pain, and the motion had returned.
And should we give that credit to Brian?
Brian Mulligan, yep, out of New Zealand.
New Zealand is where he's
wonderful, wonderful guy. I've used a lot of his techniques.
Yeah, we've been to a seminar with him in person.
Right.
It was a really good,
really
weekend.
good. Yeah. All right, what's the second case?
Okay, this is a neck and shoulder pain. This woman's 57 years old. She works at a computer all day long, and she's been to the doctor. She went to the neurologist, and she had a number of doctor visits. She had an X-ray, 2 MRIs, not 1, but 2 MRIs.
For whatever reason.
And then they scheduled the EMG. Well, somehow she got a therapy session between the MRIs and the EMG, and I looked at her. She had pain here all the way down to her arm. She said it felt like cold water running down it, and this was really causing problems with her work as well as her personal life. At night, sleeping, it would wake her up. The first day I looked at her, I used the McKinsey system. We like that system personally.
Exactly.
But anyways, the second visit, she came back, she was doing the exercises, she had success right away. I showed her the extension exercises. It felt good. Things were centralizing. I'm not going to get into that now. But her second visit, pain and symptoms went down 50%.
Wow, and this is after spending thousands. We could say literally thousands of dollars.
Easily. The MRIs are 15.
So she would have skipped all those steps, and they would have just sent her to physical therapy right away.
Right.
For a couple $100 or less,
right.
She would have got the same result, which is a very good result. But she wouldn't have spent all the money.
Exactly. And all the time, you got to take time off of work. In her case, she's got to drive 35 miles to the hospital. It's a half a day.
And then you start thinking, I have something really serious because it really hurts.
Exactly.
So,
you're thinking the worst. And if she would have went to therapy first, those first 2 or 3 visits, things are good, and then you're done. And if it's not simply solved by PT, then we send them on.
By the way, at the end of this video, I will link to an ankle sprain video. I'll link to the neck pain one too.
Sure. Okay.
And even for this third example, the shoulder pain, Brad.
Right.
Let's hear this one.
This is a classic. This woman, she's 61 years old, and she had shoulder pain to the point where she could only lift it up this high. She went to her primary doctor. That doctor sent to an orthopedic doctor. That doctor gave an injection. That wasn't helpful. She got an MRI. That didn't show anything clear.
Again,
except
the money is clicking in.
Yeah, we're
I mean,
talking $4,000 to $5,000 in all these visits, and surgery was scheduled. And then a doctor that was along with said, "What about PT?" And
physical therapy.
Physical therapy, and the orthopedic doctor says, "Well, yeah, we can give it a try." And, she knew us, so she came over, and this is no kidding. 4 visits later, her symptoms were over 80% gone.
Wow.
She could lift her arm from here to here. And I still see her today because she comes around, she lives in the area, and her shoulder's fine, and this is over 8 months ago.
Now, we don't always get these results. I mean, we're telling you the good ones, but we get these results quite often.
Right.
And if they don't, then you know you did everything you could do,
Right.
and now it is time to spend the more money.
Well, at the cost, look at it. You spend 3 or 4 visits of therapy, and if it doesn't work out, that's still probably as cheap as 1 visit to the doctor.
Exactly.
Well, 2 for sure. The
Right.
doctors are making big bucks, I'm telling you.
Not us. The money's not flowing our way. So, well, thanks for watching. I hope we've convinced you that physical therapy can play a role in your life, and please subscribe to us if you haven't already.
And from Azerbaijan, that's a tough. Azerbaijan. I'll get this. I'll talk to Sophia, and she'll get me squared around the pronunciation. I hope this covers out what you want and is going to help you with your PTA association.
Thanks for watching.